I had back surgery about 13 years ago, and I did well up until about 3 years ago when I started having the problems, which I thought was my hip and my leg. When I say excruciating pain, I was in a lot of pain. Numbness in both my legs, in my feet, just pain constantly, constant pain. I thought it was my hip. My legs would get numb. I would stop because sometimes it would get so numb. I would stop because I thought, if I move, I'm gonna fall, because I couldn't feel my legs. So I work here at Union Memorial, so I went to see Dr. Howard, told Dr. Howard about my hip. Dr. Howard says it's not your hip, it's your back. He referred me to Dr. Dorian, who I went to see, had an MRI, and he said it's your back. And it was in bad shape. He said there's nothing else I can do but surgery. When he said surgery, it was such a relief. It was like, okay, so the pain is gonna be gone, you know. I wouldn't be able to continue to work in the job that I do with my back the way that it was. He told me that he would have to go in and remove all of that hardware. It took about 5 hours when I had that surgery 13 years ago. So it took about 2 hours when he did this surgery. I remember waking up through that whole process. And honestly, I wouldn't tell you this if it wasn't true, and I didn't have any pain. I think the pain that I had before the surgery was so intense that having the surgery and getting through that was just a lot better. It's just a lot better. I remember Dr. Dorian saying to me, you're not using the pain medicine. I said, because I'm not in pain. But I can't praise Dr. Dorian enough. I really can't. If he hadn't have done it, I wouldn't be here. I'm working every day. I don't miss any time, and I'm free of pain. I'm free of pain. And that to me is the ultimate, to just be free of pain and to be able to continue to work in this job that I enjoy doing.